So sclerotherapy and micro-sclerotherapy is a treatment, an injectable treatment for treating thread veins and spider veins on the legs, anywhere on the legs. Spider veins or thread veins they can appear from any age from the early 20s, and there's lots of causes for them. It can often be associated that they develop through pregnancy, because of the high estrogen levels cause the veins and the little veins to dilate and stay open. It can be just part of the aging process. It can be localized trauma. You might have knocked your leg and then subsequently develop some thread veins and spider veins in that area. So they appear as either little red or blue spidery veins in the skin, anywhere in the legs, and sclerotherapy and microsclerotherapy is an effective treatment for them. Micro-sclerotherapy and sclerotherapy involves an injection into those thread veins and spider veins with a chemical called a sclerosant. And we inject that, we use a very, very fine needle under very high-powered polarized magnification to see these little thread veins in more detail. And once that sclerosant goes inside the thread vein, it creates an inflammation which shuts the vein down and destroys it effectively, so that they over time will disappear, and that is the most effective way. I know there are other people who will try laser and other types of treatments, but I find that with leg veins, certainly with spider and thread veins, that injection sclerotherapy is by far the most effective treatment. It's not particularly a painful treatment. There's a slight discomfort with the injection itself, although we use absolutely tiny needles, so most people barely feel that needle. The sclerosant itself can sometimes cause a little bit of irritation and inflammation, so it's not uncommon afterwards that the skin feels really itchy and irritable for a day or two. And simple antihistamine tablets will make that much more comfortable, but it settles down very, very quickly. So after treatments, the little thread veins and spider veins that have been treated, they may look worse before they get better. So because there's this inflammation within the little veins that is destroying the veins. So they will look worse, and that takes quite a number of weeks for the veins, as they're destroyed, to gradually fade away. But most people are out and about in their normal activities. We need you to avoid sun exposure to the legs whilst you're having a course of treatment with sclerotherapy. So you have to sort of work out when's a good time for you. The other thing that's very important, when we do a treatment, we will put a compression bandage on for the first day after treatment. And following that, for a number of weeks, you'll wear some compression hosiery or compression tights or stockings. They're not as bad as they sound. They're not like the old hospital ones where you can access compression hosiery that looks like normal stockings and tights, but just providing that compression to the tissue so it makes sure that the treatment is more effective and that there aren't any complications such as excessive bruising and staining of the skin from the treatment. So you're wearing compression for a number of weeks afterwards. Depending on the number of thread veins that you have, most people will require between 1 and 3 treatments in most cases. Those with multiple veins and long-standing veins are likely to need 3 treatments. And we normally space the sessions apart. Maybe every 3 or 4 weeks we may be doing a treatment session. So a lot of our patients come forward in the autumn and winter and early spring to have treatments because, as I said, it takes time for the treatment to work and for the legs to look great. So if you're wanting great legs for next summer, the autumn and the winter is the time to think about having microsclerotherapy or sclerotherapy treatments. So the patients who are really not suitable for injection sclerotherapy is where they have significant vascular disease in the legs. So in this situation, if you have definite varicose veins, then they need to be treated first before you can tackle the thread veins and spider veins on the legs. So In that situation, if you have varicose veins, you really need to see a vascular surgeon to have a more definitive treatment to the varicose veins. And once they've been treated, then yes, we can then proceed with the cosmetic treatment to remove the thread veins and spider veins with sclerotherapy. Sclerotherapy can only really be used on the legs. It's not a treatment for the broken veins on the face. We do have other treatments such as thermovane for treating the veins on the face if needed.